Hi, everyone. My name is Jen Braun, and I direct the AHA Team Training Program here at the American Hospital Association. Excuse me. Welcome to our special webinar that is really everything you need to know about the role of a master trainer and what to expect at a two-day master training course. We're going to provide some great information today and some best practices. I'll introduce you to my co-presenters here in a moment. Who are our master trainers. But first, I wanted to just briefly highlight our agenda. So today we're going to specifically share the key roles of a master trainer. Oftentimes we get asked, what is the definition of a master trainer? What are the expectations? Well, we'll share those with you, along with how do I select them at my organization? Who do I choose to send to a master training course? We'll highlight what you can expect at a two-day AHA TeamSTEPPS Master Training course, and we'll share some exclusive resources for pre and post training. And so finally, before we get into it, I just want to share some rules of engagement. So we have a shared mental model. You can access audio by listening in through your computer speakers or through your phone. If you're having issues with either one, you should be able to access the toolbar at the bottom to switch to either phone or computer audio. Please note that you're in a listen-only mode right now. We'll be doing a Q&A session with our master trainers who you'll get to meet here shortly. And you can submit your questions for them throughout the webinar today through the chat as it comes to your mind. When we get to the Q&A session, you can also raise your hand and we can unmute you. This session will be recorded, and so the chat will not be included in the recording, and we'll be emailing you this week when the recording is available in case you wish to revisit or share with another colleague. And like I said, feel free to use the chat throughout. We can answer logistical questions in the moment, but again, we'll save those questions for our master trainers at the end. And just keep in mind that you can chat everyone in this webinar or chat individually to specific participants or to us as the hosts. And so I kind of briefly introduced myself, but again, my name is Jen Braun and I direct the program. I have been a master trainer since 2011, and I'm non-clinical by background, but have worked with dozens, if not hundreds of teams from across the country implementing TeamSTEPPS, as well as here implementing it at the AHA in our non-clinical, non-patient care setting. Rachel, would you like to go next?
Hi, everyone. My name is Rachel Vandervoort. I am a program specialist here with AHA Team Training. My day-to-day life is mostly in operations and support for our people across our community, both our faculty and those coming to get trained in TeamSTEPPS. I am a TeamSTEPPS Master Trainer. I completed my first course in 2018. And like Jen, I am non-clinical by background, but have been on the ground with clinical and non-clinical healthcare folks for over 5 years now. So very excited to share with you today what we have done with our TeamSTEPPS courses.
Thanks, Rachel. And we have some fabulous master trainers who have joined us here today who are our true experts, boots on the ground, clinical folks. So I'm going to let Jill introduce herself.
Hi, I'm Jill Alvarado. Like Jen said, I am clinical. I've been a labor and delivery nurse for the last 18 years, and I have done a variety of roles in the clinical setting, but all in obstetrics. I found a love for precepting and being a mentor. I've been in administration, but always somehow find my way back to the bedside. It's truly what I love. So I'm excited to share with you guys what TeamSTEPPS has done for me in my career and for my organization.
Thanks, Jill. And David?
Great. Good afternoon or good morning. It's afternoon where I am here in New Jersey. I'm David Feldman. I sort of consider myself an alternative career doc, for lack of a better term. I'm a plastic surgeon by background, but really spent many years at a urban hospital in Brooklyn, New York, did a variety of things, including running operating rooms. And I like to say when you work in an OR, you stare patient safety in the face. And I became passionate about respect and patient safety. And of course, teamwork comes along with that. And about 11, 12 years ago, became the chief medical officer for a malpractice company, first in New York and then nationally, working with clinicians, doctors, nurses, allied health professionals on how to make healthcare safe and reduce malpractice risk. And of course, key to that is teamwork. So delighted to be with you all today and share some thoughts. not sure I'd call myself, what was the term you used for us? Fabulous? That's, no, probably not. But anyway, we'll try.
Extraordinary. I'll use it all. But as you can see, everyone's in great hands here today with the team we have. I'll ask Jill and David to chime in as they feel that like they can, or in the chat, but we'll definitely have some time for Q&A with them later on. So we would love to hear a bit more about you and understand who else is on the webinar and where your background is. So Rachel's going to put up a chat right now. So just so we can get to know each other, what describes your background or training? Physician, we got APRN or NP, nurse, pharmacist, allied health, CNA tech, non-clinical other. We'll give everyone here a few moments. And I know there are some other questions also that have popped up. So what's your role in your organization? And is your organization currently implementing TeamSTEPPS? Just to give us a little bit of a pulse on who we have here. So there's 3 questions in the poll. And I think everyone should be able to see the results in real time, right? I'm looking at maybe Jill and David to give me a thumbs up. Nope. Okay, we'll share results here in just a second. We'll give everyone a few more seconds to complete it.
We're about 80% response rate.
Okay,
so
great. If you could share the results, that would be excellent so everyone can see. Great, so you should be able to see the results now. So it looks like we have about 50% here are nurses. The next biggest group is our non-clinical folks. So yay, hi, along with allied health. When it comes to what is your role, again, a pretty great spread actually. The biggest group is about 40% managers, followed by other. Staff falls into that category, and director. We got some C-suite folks here. Excellent. So this is really, so you are really representing the healthcare team. This is who we're targeting with TeamSTEPPS. And so again, you are representing that right now. And then finally, is your organization currently implementing TeamSTEPPS? Wow, almost like an exact even spread across yes, no, and unsure. So that's great. For those that you are unsure, I would venture to say that there's likely pockets of TeamSTEPPS everywhere. Likely TeamSTEPPS is being done, whether intentionally or not. A lot of the tools are so related to what people are already doing. We just like to really put a structure and some language surrounding it for that spread and sustainability component. But thank you for taking time to answer that. We're going to move on and jump right in. Before we get in, we thought we would just have a bit of a shared mental model on who we are and where we've come from. TeamSTEPPS is evidence-based, so it was originally developed by the Agency for Healthcare Research and Quality, so AHRQ, or we'll refer to them as ARC, in the early 2000s. So they launched the national implementation of TeamSTEPPS in 2008, and ultimately AHA got involved and served as the lead starting in 2011. ARC ended the funding in 2017, and that's when we at AHA decided to continue the TeamSTEPPS movement and launch AHA Team Training. And so we continued many of the same offerings we did during our time with ARC, so our public courses, our monthly webinars, but we were able to expand our offerings, which included working exclusively with hospitals and health systems to provide custom trainings. And we were really able to sink our teeth into the curriculum and make some great innovations. And so like the rest of the world, we pivoted to virtual offerings during the pandemic and continued to enhance our curriculum, which includes elements of what's called human-centered design. So we'll share more about that here today. For those of you who hadn't heard, ARC released TeamSTEPPS 3.0 in 2023. And this is simply an updated version. Ultimately, it includes a couple of new tools along with some key themes to the healthcare landscape that have changed over time. The curriculum of 2.0 was updated, I want to say, in 2014. So a lot has changed in that time. So virtual teams, technology, the greater emphasis of staff well-being, expanding the definition of patients and families to patients, families, and caregivers. So ultimately, there aren't too many significant changes to the 2-day master training course itself. But in 2024, we had AHA Team Training incorporated some of the minor changes of 3.0, included some other modifications that we'll share here today. So ultimately, we assume you're here to learn more about master trainers and what their role is and how to select them. And so we thought we would share with you our view of the role of a master trainer. So back in the day, 10, 15 years ago, the role of a master trainer was very clearly defined as someone who is an expert in TeamSTEPPS, who can take TeamSTEPPS and teach it to others. We know when it comes to culture change and leading change in general, there's much more to it than that. And so to support your TeamSTEPPS programs back at your organization, your role of a master trainer may fall under 2 or more of the following. Overall, everyone who comes to a master training course, your role is to role model the behaviors, role model the tools in practice. Oftentimes, you'll also have the skill set to provide that just-in-time coaching to your peers, because many of those TeamSTEPPS tools can be reinforced in the moment. And now this is where people kind of start to deviate. Again, some folks who are master trainers will have that role of being a teacher and facilitating TeamSTEPPS trainings, versus others, maybe that's just not their skill set. That's not something they're able to do or passionate about, but there's still a role as a master trainer of assisting in developing the implementation plan that you may continue to oversee it when you return back to your organization. You may support or serve as a member on the change team. And so a change team is people in your organization or on your unit that can carry really the vision and the culture change through TeamSTEPPS and work together to really find those practical ways to bring it to life and keep it going. So those are the general roles. So when you're thinking about it, you want to identify people that you know can teach the course, you know has the skill set, but there's also going to be folks that you may not want to disclude because that's not their arena. They might be really great in being a champion, doing that just-in-time coaching, providing input and oversight of the implementation plan. So you kind of want to have a mix of both. And so some key characteristics that we feel like are important when selecting or identifying master trainers is you really want them to be able to influence others, right? So those that are respected by their peers. Being passionate about quality and patient safety can certainly go a long way when communicating that to others. Having just a strong team orientation. If you have a master trainer who doesn't care about teamwork, that's an easy way to cut them loose from the list of master trainers. Really anyone who's eager to learn and receptive to change. You know, change is scary. We know that there's a lot of change going on a lot, but for those that are really eager to develop their own, teamwork and leadership skills, really great to have as master trainers. And of course, you want someone who can effectively communicate, whether that's standing at the front of a class effectively communicating or effectively communicating what's our vision for TeamSTEPPS. I'm going to give you a pitch about it. So being an effective communicator, both at a large scale or small. Oh, I forgot. There's another polling question. So which of these, I'll have Rachel launch that. Which of these characteristics do you think will be most important for getting traction with your team? Which characteristic of what we consider to be great master trainers do you think is most important?
And there's no wrong answer here. Different teams need different things. So this really is about starting to understand who you're working with and develop that shared mental model.
Great shout, Rachel. Okay, I think we can show the results. The majority of folks felt that eager to learn and receptive to change. Yeah, I would never turn down a volunteer who wants to be a master trainer, frankly. And the effective communicator, and again, thinking about that both on a one-to-one level of influencing their peers or being able to hold the facilitator role to a larger group. Okay. We often get the question, how many master trainers do I need? Before we answer that, it really is dependent on the size and scope of your implementation, whether you're implementing it in a clinical area, hospital-wide, system-wide. But the ultimate thing to take away here is you want to make it interprofessional and interdisciplinary. We on this call, myself, Jill, David, Rachel, we are representatives of an interprofessional multidisciplinary team. So you want your master trainers to reflect that as well. Ultimately, if you have a smaller organization, you might consider having maybe 2 master trainers per service line or clinical area, or maybe about 10 in the organization, maybe a little more. For larger groups, again, these are just really rough numbers, just to give you maybe a base. You might think of having 4 to 6 per clinical area or service line, and maybe upwards of 30 at your organization or more. Again, there's no magic answer for this, but just to give you a sense, I'm sure David and Jill can chime in later on that if there's more questions, but just to give you at least a rough idea. So ultimately, we want to share with you a bit more about our master training courses. So I'm going to turn it over to Rachel.
Hello again. One thing to keep in mind as I'm talking about our master training course, a lot of the language and focus will be on our in-person course, our 2-day in-person course, but we also do offer a 8-week virtual course with the same content, the same concepts, the same innovations. So just keep in mind that when I say day 1 and day 2 virtually, it could be a little different timeline, but still same content. So what do I mean by day 1 and day 2? When you show up to a master training course, there's a lot that we pack in, but we kind of divide it in a way that we think is really supportive for the adult learners. Day 1 is all about the TeamSTEPPS fundamentals. What are the tools? How are they used? How can you practice them? Like really getting familiar with the terminology and the application of what's going on and practicing it. You know, it's not very conducive to just hear something once and walk away and expect it to stick, right? So yeah, we definitely like to encourage the experiential learning. And then on day 2, we're going to help you translate everything you learned on day 1 and start applying it to your teams, to your organization, to your everyday work life, and making that sort of actionable plan out of these really great ideas. As you can see, there's a little bit more detail to day 1 and day 2 agenda. And Jen will go into some of the more details about the curriculum updates that we've done. But really, like I mentioned, day 1 is the fundamentals. You'll see the 4 TeamSTEPPS teachable, learnable skill sets in there: communication, leading teams, mutual support, situation monitoring. We've also added the TeamSTEPPS training design module, which is exclusive to AHA Team Training. That's something that Jen and another facilitator, Rhonda, who could not join this call today, they've been working on tirelessly, and it's a really excellent addition to help get those training ideas started before you walk out the door on day 1. And then day 2, that's where that human-centered design thinking comes in. We really are moving from learning to doing. And yeah, Jen can tell you more about what that looks like on a detailed level.
So with some of the curriculum innovations that we're really excited to share about, I thought I would kind of summarize here, and we'll go into a bit more detail for each of them and give you a bit of a preview. But ultimately, as Rachel said, we spent a lot of time and effort working with our network of master trainers, including these 2 here, and our advisors to enhance our AHA version of the TeamSTEPPS Master Trainer curriculum. And so ultimately, we've addressed these 3 areas. One is incorporating in what's called human-centered design canvases. I'll share more about that here in a minute, but you can see in that picture, they're very visual canvases that teams work on creating together. We've made some great content updates that Rachel's alluded to, and then we've incorporated even more experiential learning opportunities throughout our courses. So first and foremost, for those that aren't familiar with human-centered design, it's really a problem-solving technique that aims to put the people at the center of the development process. So it really gives teams the ability to create products or services or programs like TeamSTEPPS that resonate and are tailored to your audience needs, whether your audience is your patients or your colleagues or both. But the aims of human-centered design or design thinking, those terms are used interchangeably, it's to ultimately reduce really complex challenges and make them more manageable, and bringing in that team collaboration by having multiple insights and bringing in different perspectives. After you're able to validate and test some of these key concepts and assumptions early on so that you're able to pivot and modify and scale if needed. And all of these ultimately produce results that resonate with the people you're trying to create value for. And so we've incorporated these human-centered design canvases, a couple of examples are on the slide here, into our master training course to, again, make that complex and sometimes overwhelming challenge of how are we going to teach and implement TeamSTEPPS at our hospital, make it more manageable. And what's unique about our course is we have teams work on their plan throughout the 2 days from both a strategic and tactical perspective. It's created throughout. So it's not just like, okay, here's a bunch of information, now spend half a day putting together a plan. You're really building it as we're going along. And so teams walk away with a plan for the big picture along with immediate next steps. And then going into some of the content updates that have been incorporated. First, we made sure to align our curriculum with the 3.0 updates. So an example is, the original handoff tool for TeamSTEPPS was this crazy, ridiculously long, scary acronym. It was I pass the baton. And no one was using it because obviously. And so ARC had changed it to iPass. And many of us had already started adapting that already, but that was just the official change. They added in a situation monitoring tool called STAR, which I believe comes from HROs, if I'm right. Hopefully I'm not misspeaking. And then there's been some key themes that ARC embedded throughout the healthcare environment and landscape since the TeamSTEPPS was updated 10 years ago or more. So again, that includes ensuring the key themes exist with patients, families, and caregivers, the technology aspect, obviously with virtual teams, and really focusing on well-being and burnout. Ultimately, TeamSTEPPS, I think, was really not promoted, but utilized as a tool for patient safety. And that is still the case, but there's team performance that's part of that. There's the well-being and the support of our team members, because if you don't have a solid foundation for that, your patient safety is at risk. So not necessarily turning our back towards patient safety, but taking care of our teams has been definitely a theme that is loud and clear there. Some new content that's exclusive to AHA Team Training. So again, we turn to our advisors, our network of master trainers, and feedback from course participants, and identified a few gaps in the curriculum. The first being psychological safety. So our teams are in turmoil with a rise in workplace violence, challenges with staffing ratios, and the list can go on. And so fostering a culture of psychological safety where team members feel comfortable speaking up and feel a sense of belonging is critical. So that is tied into our course. Another theme that we identified that was a gap was how to manage and influence resistant stakeholders. TeamSTEPPS is not meant to be owned by one person or one team. It's really critical to examine the stakeholders involved, especially those who are resistant, and develop strategies on how to get them engaged. So often the common question we would have in our course is, well, this person or this role in our organization, like, we know they're not going to be involved. What do we do? How do we get them on board? How do we deal with this? So we wanted to dedicate time and space to have those conversations and develop those strategies. Finally, a large gap that was identified is how to design and execute participants' own TeamSTEPPS training plans and education plans for their teams back at home. There'd be a master training course back in the day, it'd be a lot of information, but you're saying to yourself, well, I'm not gonna be teaching a 2-day course. So we've dedicated an entire module and give teams who attend our master training course the time and resources to create or start creating the guardrails for their abbreviated TeamSTEPPS courses back at their organizations. So it's not realistic, like I said, for folks to train everyone in 2 days of master training. That's not the intent. The intent is for master trainers to go back and train in what we call TeamSTEPPS Essentials. And so that could be 4 hours, that could be two-hour sessions. Those could be one tool at a time in order to get through everything. And so we really give our course participants a framework and options and best practices so that they can start building that plan. And so we provide a lot of resources along the way after the course because there's no need to reinvent the wheel. Our unofficial model of TeamSTEPPS is we like to steal shamelessly and give generously. So our materials, once you come to our course, are available to everyone. We provide facilitation materials, we provide slides that can be used and adapted. So just keeping that in mind. Oh, and this is just a preview of that TeamSTEPPS training design module of how we talk about how to, ways to teach it. We talk about strategies for teaching the tools and everything effectively. And so finally, the last curriculum innovation or enhancement we continue to include and reinforce are our experiential learning opportunities. So no one wants to go to a course that is filled with lecture and maybe some like group discussion, right? We give teams the opportunity to get out of their chairs and put the tools in practice. And so we lead simulations throughout the course, whether low-tech simulations specifically, whether it's with the paper chains that you see there on the top or the Lego towers that you see there on the bottom. We spend a lot of dedicated time debriefing because that's really where the learning opportunities are. We make connections after videos and simulations during our debriefs to the TeamSTEPPS tools and principles. We also use concepts from liberating structures for group collaboration and discussion. Liberating structures, you can Google it. It's a facilitation technique, which really ultimately emphasizes inclusivity. It enables everyone in the group to share their perspectives. It's just a really great toolkit to utilize group conversation and activity. It gives you a lot of great ideas. Similarly, we engage in what we call a community of inquiry, meaning we have so many experts in the room, so participants from across the country, from different clinical backgrounds. And so it's not just our faculty and our master trainers, but it's the course participants that are the experts too. And it's a unique opportunity to network and learn from others from across the country. So we like to leverage that as much as possible too. So before we open it up for Q&A, again, feel free to chat in questions as you have them. Wanted to share some pre and post training support that we offer. So something that we're really excited about that's new is our pre-TeamSTEPPS implementation checklist. Rachel just chatted it in. And so this is really meant to serve as a guide or best practices on preparing for TeamSTEPPS implementation, whether it's some things you do before the master training course or after, before you really start kicking things into gear. It's self-guided, so you can really kind of complete it at your own pace, but we talk about different strategies for obtaining executive support when it comes to key stakeholders, giving suggestions or areas on how to identify the audience that you're going to work with or pilot areas, helping determine who will be master trainers. We have a whole section on goals and measures. So what's your why for doing TeamSTEPPS? What's your purpose for doing it? Starting to identify some process and clinical outcomes. Again, this isn't meant to be you need to do all these things before you come to a master training course, but really just some best practices and some things to consider for based on what others have done and have been successful with. So Rachel shared that in the chat for you guys to utilize as a thank you for being here today. And then finally, we don't just teach you and feed you and leave you. We provide some post-training support as well. Similarly to the pre-TeamSTEPPS checklist, there's a post checklist as well that participants get. We're going to be starting to do quarterly conversations. So convening master trainers together who've attended a course to share, problem solve, celebrate wins, hear what best practices from others, talk to master trainers who are experienced for some problem solving. So that's available to those who attend our courses. And then, like I mentioned earlier, we provide training materials. So we give course participants the 2-day slides. We give them a 4-hour deck as well for those abbreviated trainings with facilitator guides. So we do like to support as much as we can following the 2-day course because we want you to be successful. And so Rachel's going to chat in the question just to get a pulse. As you think about implementing TeamSTEPPS, in which of these areas do you think your organization needs the most support in? Is it that pre-training support and readiness? Or is that more the post-training support and sustainability? So just some food for thought. Would like to get everyone's feedback as to what some of those felt needs are. As those questions come in, I'm going to stop sharing my screen so I can see everyone there. And so now really is the time to get some of our questions, or rather your questions, answered when it comes to our expert master trainers here. So I don't know if any questions have gone through, but I'll check the chat here in a minute, but I'm gonna start off with just kind of an intro question to you both. So how did you get involved or become master trainers? Were you voluntold? Did you volunteer? Or what made you say yes?
I'll go first. So I feel like honestly I was very lucky. Houston Methodist, the hospital that I work for, is a master training site here in Houston, and one of the OBs, Stacy Norton, who is a master trainer, she invited me to it, and so I just fell into it. But when I took the course, it really resonated with me, and then I went from there. So voluntold maybe, but I willingly did it, and I was very fortunate to be part of that.
Perhaps Dr. Norton saw some of those key characteristics that make a good master trainer in you.
I think that was probably intentional, yes.
David, what about you?
So yeah, sure. So for me, becoming a patient safety guru, I don't know what else to call it. I recognize that once we could develop a culture of respectfulness, it speaks to the psychological safety you brought up. I think that's so critical. Then I realized the two things that you can affect in any system, healthcare anywhere else, are the people and the system around it. So the first is really about team training. The second is about human factors. It's a topic for a different day. And what attracted me really to the TeamSTEPPS was the idea of being, and you alluded to this idea of being both an impact on performance and patient safety.
Mm-hmm.
And I think most of you will find that critical as you start doing this. Unfortunately, especially in 2024, people want to know an ROI. They want to know what the return on investment is going to be. And sometimes it's easier to convince finance people. Sorry if there's any finance people on. I have deep respect for all of you in healthcare, to be honest. It's easy to show sometimes the benefits of teamwork on performance than it is on patient safety, at least in the near term. So that's sort of what attracted it to me. And working in the malpractice world, it became critical in high risk areas. That's really where I spent a lot of time, in OB and surgery and ED, where it's often needed the most, and it was easier to make the case for it. And many of the clinicians I worked with were really anxious for it. And then I became part of it and have never looked back, really.
Great. So I think an unexpected benefit, at least for me, of being a master trainer was the impact to my own professional development and leadership skills. I'm wondering if maybe you two could speak to how being a master trainer has impacted that part of your maybe professional or leadership development.
Yeah, absolutely. I feel like TeamSTEPPS gives the tools for solving complex problems. So when you have a really complex issue that you're dealing with, which we all do in healthcare, TeamSTEPPS tools actually simplify those complex situations that are going on so that you can easily dive into the issue. So I want to give one example of how these TeamSTEPPS tools were utilized to improve a quality metric that we had. We had an issue that for women that are hypertensive, you should administer antihypertensives within a 60-minute window. Our numbers here at my location, they were I guess abysmal is the best word to describe it. They were not good, and that is something you have to admit. So it's this very complex problem of how do we get everybody on board. So you just take one tool and you start there, and it's kind of what David was talking about. You start with the team. You know, sometimes I think we want to jump in and solve the quality issue right there, but it's really foundational about bringing the team together. Presenting the issue and then simulating and practicing what that was looking like. So we used SBAR as a communication tool to do simulations. We changed our process, but then using the simulations in the SBAR, we were able to turn around in just a month's time, which is really impressive, to the point where we have been now at 96% or above for the last year since the implementation of simulations using TeamSTEPPS. So that is definitely my why. I've seen it work, and that helps build the team. And then at the end of the day, what you're doing is really the quality outcomes for your patients.
Awesome. Yeah, I know having those measurable results can really help impact and drive the why further beyond just that clinical area. So that's great. And I know you've been so involved, obviously, in TeamSTEPPS that it's impacted your, leadership and professional development, getting to, not to toot our own horns, but like work with us at a national level too. And we're so lucky to have you.
Thank you, Jim.
Yeah. I guess for me, there's lots of pieces of the TeamSTEPPS puzzle that have resonated with me. As a surgeon, the leadership tools, the briefs, huddles, and debriefs, I thought were just so critical and of interest. Everybody's familiar with the infamous WHO checklist, but you're all familiar with the data that shows if you just give people a checklist and nothing else, it doesn't work. The entire province of Ontario in Canada did this years ago, and it didn't change anything. If you add something like TeamSTEPPS training, like they did in a study that came out of Scotland, it can make a huge difference. So it's this teamwork thing that really makes a difference. Shared mental model is the term. I probably use that term, forget professional life. I use it at home with my kids and my wife. It's like, we need to have a shared mental model on this. It is such an important term that I find it's really made an impact on me. The psychological safety that we referred to and other tools in the mutual support realm, I think is critical. And then one of the things that I think we learn, and you heard some of this about communication in and of itself. If nothing else, the last 4 years, so much of our communication, look what we're doing now, we're on a video call. And so much of our communication is by text or email. And we all know as humans, that's not how we communicate. 80% of how we communicate is all the body language. And in healthcare, it's in person. You've got to really understand that to make a difference. But at the end of the day, and like Jill, I think for us, we looked at, it took a long time, but after 10 years, we looked at the impact on retained surgical items. And this is a study that was published in the Journal of the American College of Surgeons about 1.5 years ago. And we implemented 2 things. It's a retrospective study, so can't really establish cause and effect. But we did 2 things in those 10 years, affecting the things I alluded to before, right? We put in chips in our sponges, and we implemented team training in all our surgical teams. We reduced the number of retained surgical items in half. Over 10 years. It took a long time to do it. But I think the idea is that teamwork was such an important tool that it can really make a difference. It really can make a difference. And I've seen it firsthand. It's an impressive thing for performance and patient safety.
Yeah, great points, and can tell that both of you are obviously very passionate about TeamSTEPPS and have seen it in action and see the benefits. Some questions have rolled in more on just kind of miscellaneous questions regarding the curriculum, regarding implementation approaches. So I'm going to do like a bit of a rapid fire approach here. So one of the questions is, I'll start the question, but I'll let you close out, is so we mentioned that we included psychological safety as a key theme. And so we had a webinar participant ask if we have a specific module for psychological safety. And I'll say that we don't have a specific module, but really the concept of psychological safety is included throughout, because there's so many different TeamSTEPPS tools that help foster a culture of psychological safety. So for instance, briefs and debriefs, especially debriefs, getting team members to just first feel comfortable, say in a debrief, sharing what went well. So one of the tools is a debrief, and we always ask what went well following an event, following a procedure, following the shift. And so by getting people to start with that, that's easier than saying, well, what didn't go well? So that is an element of enhancing psychological safety.
If you think about it, in a brief or debrief huddle, getting people to introduce themselves, we've probably all of you have heard this already, right? Just the idea, and I'm a surgeon, I can tell you a lot of surgeons poo-poo this, but I think they're wrong. It takes about 30 seconds for the OR team to introduce themselves. And there's plenty of psychological studies that show once people say something, even if it's their name, it gives them permission to say something like, I think you're prepping the wrong knee, right? That's part of this whole theme of psychological safety, giving anybody in the room, it doesn't matter who they are or what their background, permission to say something if they think there's something wrong. That's so critical, and it's a core part of team training.
Yeah, good points. And yeah, so there's a whole module on mutual support, and having each other's backs and tools to speak up. So again, that plays into psychological safety as well. This is more of an implementation question for your input. So, once you're a master trainer, do you see more success and sustainability with implementing a phased approach? So starting with maybe some individual departments versus a big bang approach. So say maybe the whole hospital or organization at once.
Yes. That's my short answer. It's very individual. And I think somebody just chatted in. I had one department of OB folks, they picked one skill for like a couple of months at a time. SBAR, fine. And they focused on that. Every meeting they had, they focused on that. The next time it was cuss. The next time it was something else. Sometimes that works better. Sometimes, and again, I come from an OR, so I'm a little skewed, but the idea of closing your ORs down for a half a day so you can do, that doesn't fly by anybody. On the other hand, surgical folks have an advantage. Every hospital I know of has a late day. Why? Surgeons, nurses, anesthesiologists have their conferences. So people are there, but they're not working, if you will. They're not in the OR. Ideal time to have a 1-hour session on TeamSTEPPS. I do like the idea of repetition. I think trying to do everything all at once, people forget. That's the hardest part. We can probably talk forever about sustainability, but I think you get a better chance of doing that if you do this over time and you constantly repeat these things to people, get some feedback and so forth. That's just my personal bet, but you got to do what works for your institution.
Mm-hmm. Jill, do you have?
I would agree. I think just taking little bits at a time is the best way to influence change. Because if you have a really big project, it just doesn't seem to meet those individual needs. So the approach that my team is currently taking is quarterly. We have a different TeamSTEPPS tool, and David, you alluded to this as well. So for quarter one, we did SPAR. And so we have simulations quarterly. And so part of our simulation is the communication key component, because again, that's what leads to patient safety. So we'll do SBAR, we'll do CUS, we'll do closed loop communication. So it is repetition, it is staying the course so that you get that longevity, and it is little bits at a time. So that's just women's services. And then I will go with the physician and we'll go to endoscopy. And again, we're OB. We have no idea what's going on in endoscopy, but we just start, it's all the same tools, right? It's clinical, it's non-clinical. It doesn't matter if you're an OB or whatever the OR, it's still the same concepts, but going there, introducing it, and then the next quarter, doing some simulations. I really think that has been the best approach. And then you just keep doing it. And the more you hear it and the more you hear it, then that's when people will catch on and the change starts to occur.
Yeah, I will say from working one-on-one with hospitals and health systems, when they bring us on site to roll out TeamSTEPPS, we do try to do a phased approach, right? We'll pick a few targeted clinical areas. Let's get a benchmark of people trained, whether it's 60-70% of the department, what have you. Be able to showcase some wins and some success stories, especially when it comes to those team performance process outcomes, things like that. You're not going to move the needle on mortality or some of these big clinical outcomes right away. So how can we prove that TeamSTEPPS is effective for time to CT, or we were able to hold X amount of debriefs, starting to kind of, how do you eat an elephant one bite at a time, right? So kind of chipping away at things. So I will say that is a typical approach that we take versus let's just train the entire organization at once. There's just a quick question I want to address. Tara Brown had asked, do you see any decrease in employee turnover once TeamSTEPPS has been implemented? Yes, we have data on that. Rachel can chat in. Rachel, that flyer that we just updated, she can chat in, and there's a study that is related to retention.
I'm glad you addressed that. I saw Tara's question come up and I was like, oh, I love that because it has been the world of a difference at my organization. I will say, like, after the pandemic, I think a lot of people had a lot of turnover. There was a lot of traveling going on, and a lot of new nurses that came into the profession or transitioning from specialty to specialty. And so utilizing these like core team structures has really engaged the team, and turnover went from really horrible numbers to almost non-existent at this point. So my why it works.
Awesome. I think we have time for maybe 2 more questions, but I know I see the question from Mary Alice. I'll direct it at David since we got one in the room with us. So what is the key to getting physician participation, maybe either as a master trainer or just getting involved in TeamSTEPPS in general?
Well, listen,
you can't answer, I know you can't answer that in like 30 seconds.
Yeah, it's a long-winded answer, but let's be honest, the physicians are the so-called 600-pound gorilla in the room. I hate to say it. Look at who's attending this course today. One physician. One physician. So it's sorry, Jen, it's a little disingenuous to say we have the whole team here. No, we're missing a lot of physician involvement, and that's unfortunately typical in patient safety. It's really a problem. Physicians need to be part of this. There's lots of reasons for that. We don't have time to go into it, but I do think some of it's generational. But I like to say, I'm going to be a patient myself. I can't wait another generation for us to change, right? But I do think there's a couple of pointers to keep in mind. You will find some physicians who are engaged and want to be engaged. You need leaders. We have in some hospitals I work with, after we started implementing TeamSTEPPS, we had the chair of surgery and the OR head nurse walk around and watch people do timeouts. Now, does that send a message or what? The chair of surgery thought it was so important. You need leadership at the top, because the worst thing that could happen is somebody who's busy, a busy surgeon, I won't name a specialty because I don't want to be nasty, will do a lot of cases. Somebody says to them, he's not doing time or she's not doing timeouts the right way. And if that person can go to the head of the organization and say, tell them to leave me alone, and that happens, you lose all credibility. So you need your leadership to agree they're going to hold everybody to the same standard. If you do that, there's a green light for you. And then you need physician leaders to work with you on this. Look, we all get influenced by different things. There is a principle, some of you may be familiar with, called WIFM. What's in it for me? Sounds ridiculous, but it's true. And I know surgeons well, if you can tell them this thing's going to reduce the turnover time, reduce the amount of time a nurse spends, the circulator spends outside the room looking for things because you did a good timeout and they know what to expect, that means something to them. It really does. So you have to figure out what influences different people. And the first thing I would say is don't worry about the naysayers. There's always a couple of bad apples. If you focus on them first, you're going to kill yourself. Look for like every other initiative, look for the early adopters who you can take with you, have them become master trainers. Some people look for peers. If they see a peer doing this, they say, well, I guess I should do it too, right? So those are some tips I would give you in getting physicians to get involved. I don't know if, Jill, you have any other thoughts yourself with physicians you work with, but.
I think what you hit on is right. So one is having executive leadership support and making everyone accountable. So that's coming from the top. And then meanwhile, it's identifying who are going to be your early physician stakeholder adopters and bringing them on board to influence their peers. If they can't be a master trainer, that's okay. They can get ultimately trained in TeamSTEPPS in another way, or you can train them in a shorter abbreviated course, but they could be a key partner and stakeholder of yours. And they can kind of start to rally their peers. Those would probably be the two biggest takeaways there. Jill, anything else to add from your?
I completely agree.
I'm going to ask, I know we're running low on time, so I'm going to ask this last question to kind of bring it home. So obviously, you two are experts here. So what is your one piece of advice for prospective master trainers, or conversely, what, like, if you could go back and tell yourself something prior to being involved in TeamSTEPPS, what's that kind of one or two pieces of advice or knowledge you wish to impose on these folks here today?
I mean, my best advice is do it. So I see some comments in the chat that communication is key, and maybe that has been lost. And I think that's really relevant for all of us through the pandemic and so much, virtual time. But bringing it to your organization and using these tools, they work. Like, there's data behind it. I've seen it firsthand. So I guess my only advice is do it. The return on investment is great.
My couple of tips are try to come with a team, even if it's a small team. Just like you see here, we're trying to talk the talk and walk the walk, right? We have administrative folks that are not clinical, a nurse, physician. Try and do something like that, even if it's just one or two of them. Have them come as a team and start thinking about metrics. Metrics from the beginning, smart moves. You've all heard that term before in patient safety, SMART, right? Right. And you want to think about what things can you make as your bully pulpit? What is it that people are going to say, this is what we need to do to improve, whether it's retained surgical items, returns to OR, C-section rates, ED, waiting time, whatever it is, something that you can hang your hat on and think about what you're going to do to sustain this. Because the worst thing that could happen is you start this and it becomes what they call flavor of the month. You need to think about how we're going to keep this sustained, whether it's having your folks, your leadership walk around watching people do this. We had feedback. We published some articles on giving feedback on how they do on proxies for teamwork events, so that it just kept going. People got used to it. This takes a long time. Culture change in healthcare is years. Don't be discouraged by that. Think about the sustainment issue as you get started, and I think it'll serve you well.
Yeah. Thank you both for your excellent perspectives and comments. This was a really, really nice discussion, and thank you for your time. We really appreciate it. We're going to just close the loop on a couple of other items that Rachel's going to go through on what's next and how to get involved. So Rachel, I'll turn it over to you.
Excellent. So we assume you're all just ready and eager and gonna sign up for the courses and flood our inbox with registration requests. Do want to highlight that we have 3 courses in person coming up. Tulane and Northwell have been our faculty partners since way back on that Timeline Gen show. They were back in the ARC days. So highly recommend both of their courses. They're very knowledgeable, not only on teaching TeamSTEPPS, but implementing as well. And then new this year, we do have a course here in Chicago at our AHA offices where Jen and I work all the time, and that will also feature one of our AHA colleagues, Dr. Chris DeRienzo. He is our Chief Physician Executive, and he will be part of our faculty team for that June course. And then if you are interested, we do have a virtual course starting next week or very soon. I know that's very short notice, but it is virtual. It meets weekly on Thursdays, and there are spots available. So for all of our courses, we do offer a team rate. So if there's 3 or more of you attending the same course, we drop that registration rate from $900 per person down to $750. That will kick in automatically during registration if you register 3 people at a time. If for some reason you need to register 1 at a time, you can use the code TSTEAM to get the team rate. All that information is available on our website, and you can always email us at teamtraining@aha.org. if you need registration support. So you, besides all the wonderful, amazing things that we have talked about, master training course, you will get 13 hours of CE credit for your participation. And I think it's something comparable for the virtual as well. And that we work with Duke University and joint accreditation. So this is interprofessional CE credit. It should be applicable to all the major buckets we have listed there, as well as additional allied health fields. And then you get a certificate showing that you're a master trainer, as well as a digital badge that you can start spreading around, put it on your email signature, your LinkedIn, tell everyone that you are official. Yeah, like I said, shoot us an email, give us a call, check out our website. We are here to support you. So don't be a stranger. We'd love to hear from you, and we'll see you at our next offering.
Yeah, thank you all. We really appreciate you joining us today. Don't hesitate to reach out. We shared that pre-TeamSTEPPS implementation checklist to give you some food for thought and some guidance if you're thinking about starting to implement TeamSTEPPS or before you go to a master training course. Again, we're here to support. I'd like to thank once again Jill and David for joining us and providing a really great perspective and expertise. So thank you all, and I hope you have a great rest of your day.